Hello and welcome to our web clinic, Preparing for the CDE exam. I really appreciate you joining us today. My name is Beverly Tomasian. I'm a registered nurse and a certified diabetes educator. And I am very excited to welcome you to the world of diabetes. I've been in the field for over 20 years and I've loved every minute of it. I really enjoy working with patients and healthcare professionals to empower them with knowledge and information. So I think you're on a terrific journey, and I commend you for it. And I'm excited to share with you my knowledge about the CDE exam. I've actually taken the exam myself 4 times, and don't worry, I passed every time. You just need to take it every 5 years to keep up your certification. And over the time I've taken it, I really need to tell you that the exam has improved dramatically as far as the questions and as far as real application to what diabetes educators do. So I think the exam is well written, and let's get started on this journey as you prepare to become a certified diabetes educator. What we're going to cover in this web clinic today is what are the qualifications to take the exam? What are some recent changes in the exam format? It's come a long way in the last 20 years. What's included, what are strategies, how do you succeed, and what are some resources to help you, succeed with this test. And I want to point out that I have a lot of flowers on my slides, and these flowers are there for you to help you just realize it's okay to relax and, feel very confident and self-assured that you are going to excel in this exam and do very well. So these are just reminders to us that calm relaxation helps with a decreased anxiety and helps you access the information you know. Some notes of clarification. My company, Diabetes Educational Services, has no relationship with NCDE, which is the credentialing board that kind of determines what's going to be on the exam. And that's a good thing. They have no knowledge of, what I'm teaching here. I mean, I guess they could come and listen in, but we don't have a collaborative effort where I have a special knowledge of what is on the exam or who's writing the questions or anything like that. So I'm totally separate from them, but I do work with healthcare professionals who are entering the field of diabetes, and my main goal is to help them succeed and get into the field of diabetes because, as you know, there's a diabetes epidemic out there. And my professional goal is to help as many healthcare professionals as possible move into the field of diabetes education so we can reach out to those people with diabetes, give them the information, the tools, the education they need, empower them to take care of their diabetes in the best way possible. And it's just an honor for me to be working with awesome healthcare professionals to really extend their knowledge out to people with diabetes so they can improve their lives. So why take this exam besides the epidemic, which is very critical? But it demonstrates to employers and third-party payers and the community that you possess distinct knowledge, specialized knowledge that helps you provide awesome care for people with diabetes. And actually, the CDE is a nationally, and now it's becoming an international recognized standard in diabetes self-management education, a standard that shows, competence and a certain skill set that prepares you to do diabetes education. So who's qualified to take the exam? And all this information now is taken from the National Credentialing Board for Diabetes Educator, their website, but I've summarized it and shortened some of it. So for the complete information, I would definitely recommend you go to their website and look at all the details there because they have it laid out in a very understandable way. But first of all, you have to qualify professionally. That is, your licensure enables you to take the exam or to be qualified to take the exam. So you can see here different professions that can take the exam: RN, psychologist, OT, optometrist, pharmacist, RD, PA. And all of these different professions can take the exam. They need to have a current license from the U.S. or its territories and be practicing in the U.S. or its territories. And a healthcare professional with a master's degree in social work can take this exam also, or a healthcare professional with a minimum of a master's degrees in these different areas. This is a little more complicated. If you're in this situation, you're going to need to check out the website and see what paperwork or documentation you would need to supply to qualify for this. So definitely evaluating that more carefully would be a good idea. Now, what is the professional practice experience requirement? If you're thinking about taking this exam, you definitely need to have completed 2 years of professional practice experience in your field. So 2 years as a nurse, as a dietitian, as an OT, plus you have to have accumulated 1,000 hours of diabetes self-management experience over the last 5 years. So that means that you need to teach people with diabetes how to manage their diabetes or diabetes self-management for at least 1,000 hours, plus you need to be currently employed in a diabetes educator role for at least 4 hours a week. Now, this is very important. You need to have the title diabetes liaison, diabetes resource person, diabetes, specialist or something like that, even though you don't have your CDE yet, because you need to have a defined educator role for at least 4 hours a week. That's a really important criteria, and for some people that's hard to achieve, so it may take a little creativity in your work setting and working with your management to find a window to do that, for the opportunity to do that. In 2010, they're going to modify their professional practice experience. It's still going to be 2 years after your licensure. It's still 1,000 hours, but 40% of those hours, or 400 hours in the past year, need to be accrued. So it's 1 year preceding application needs to be 40% of your work time doing diabetes education. And that's actually going to be for renewal also, not just first-time test takers. Plus, you need to accomplish 15 hours of continuing education activities 2 years prior to applying for certification or actually renewing certification. So this is new, and I think these are some good changes. They want to make sure that you're working in diabetes, you are taking classes, and you've got 2 years of professional practice licensure before you apply. How do they define professional practice? Well, as I mentioned before, you need to be employed and compensated as a diabetes educator in a U.S. or its territories within the past 5 years. And they're going to change it, as I mentioned, to 4 years in 2010. So the important word here is actually compensated, that you need to be compensated at a similar rate as another diabetes educator in your community. So no volunteer work counts. You can't be paid $1 an hour. You have to be, paid what another diabetes educator would be paid in a similar position. The other thing is, I think I mentioned this already, only experience occurring after completing your professional degree counts. So it can't be while you're a student getting your degree. This is an important slide, these next two. What are some things, professional practice experience, that do not qualify as diabetes education? And this first bullet is very important. It's if you're, suppose, a nurse or a dietitian on the floor or OT, and during the course of your job, you teach people about diabetes. Those hours do not count. It has to be, you have dedicated hours where you do diabetes self-management education, and you have a title and you're paid for that. If you provide education to professionals, supervise them, work at a diabetes camp, volunteer at a diabetes camp. If you are, working on committees with diabetes, this is a big one here for your PAs and nurse practitioners. Providing medical assessment, diagnosis, and treatment does not count as diabetes education. So there's a real focus here, as you can see, on you need to be doing education actively. You can see here research doesn't count if you're selling diabetes supplies or products. Having a family member doesn't count. And you need to at least perform your job, one job, 4 hours a week. So if you had 2 different jobs doing diabetes education, you couldn't do one for 2 hours, the other for 2 hours. You have to do at least 4 hours per week in each job. So for more information and details, you can look at the website to see the qualifications as far as diabetes education experience.